Now, in this section, we're going to talk about the female birth control methods that use hormones. Probably the most popular one and most widely known of these is the oral contraceptive. This is often sold as a combined pill, which contains both estrogen and progestin. Progestin is an artificial version of progesterone. These became available starting in 1960, so they've been around for almost 80 years. And they are the most popular birth control method used by women in the United States. They all involve taking a pill daily. And the way that they work is they add estrogen and artificial progesterone, or progestin, to your body to mimic as if your body has high levels of estrogen and progesterone. Now, if you remember from the graph that we showed you earlier, and maybe I'll just go back to that really quick, when your body has high levels of estrogen and progesterone that you see here, that tells your body that all of this has already happened, including ovulation. And so when you take the birth control pill, what happens is your body thinks you've already ovulated, and it doesn't ovulate. So you don't get a release of an egg. Now, if you end up taking the birth control pill for decades, it's not that you're saving your eggs for later. All of the eggs in every human female has been produced at birth. And so all of your eggs continue to age throughout your lifetime, whether you use them or not. But you don't release an egg if you're on the birth control pill. And you have buildup of your uterine lining, and then what happens on the birth control pill is many of these oral contraceptives, as you can see, have estrogen and progesterone for 3 weeks, high levels in your body, and then you end up going on what's essentially a sugar pill. That works in these too. You have estrogen and progesterone for 3 weeks, and then you go on a sugar pill. It's the center ones here. And what that does is it drops the estrogen and progestin levels, or progesterone levels, in your body, mimicking the drop of the hormones that lead to shedding of your uterine lining or menstruation or your period. And so you get your period still once a month, but immediately after your period, your body thinks, oh, we've already ovulated, so it doesn't release an egg. Now, the failure rate of oral contraceptives is less than 1%, but the effective failure rate, like the real failure rate, is 1 to 2%. And that's because some women forget to take it. Sometimes the birth control pill can interfere with the activity of other drugs. So if you're taking something like antibiotics at the same time, both of those drugs have to be processed through your liver. And because it overtaxes your liver, it makes the birth control pill a little less effective. But really, it still remains really effective. The risks of birth control pills include dizziness. Some women report nausea and changes in menstruation, also changes in cramps and PMS. There are reports of women experiencing mood changes, which is to be expected since you're taking hormones, artificial hormones. Anytime you alter your hormone levels, you're going to experience a mood change. And then also weight gain. And the reason for the weight gain is thought by scientists to be a consequence of the fact that your body, when it has high estrogen and progesterone levels, causes your appetite to increase and gets you to want to eat more. So it's something that has been reported, weight gain, but can be controlled if you really have strong willpower. It's not a consequence of the medication. Also, very rarely, birth control pills can lead to blood clots and strokes, especially in women who smoke. And that's a very dangerous side effect, but it's really, really rare. In fact, being on birth control pills is a lot less dangerous than being pregnant. There's a lot more women that die giving birth than die from contraceptive pills, a lot more. There's one major downside, though, is that contraceptives like these don't protect against STIs. So if a woman were to be unsure of the STI status of her male partner, then she should use the male condom until she knows that he is clean or she's okay with his status. And again, finally, you do need a prescription for these, though that's becoming easier. There are some online services that will provide you with birth control pills. And then, of course, Planned Parenthood makes it really easy if you don't have insurance to also get birth control pill prescriptions. Now, there's another alternative that's sort of really similar, and that's these 3-packs. This one's by the name brand Seasonal, but there's a couple of different versions of these. Essentially, it's the exact same thing, but the difference is that you take the pills in series with only after 90 days taking the sugar pill. What this means is that you only get your period once every 3 months. And so it's a much longer cycle. But the CDC, FDA, and all the research indicates there is nothing wrong with getting your period once every 3 months or not getting your period at all. It doesn't impact human health in any way, and there is no obvious side effect of having your period only once every 3 months. This type of oral contraceptive has the exact same failure rate and exact same side effects as the one where you get your period once a month. Then we have lots of other options for the female hormonal birth control. So there's the patch, which essentially works the same way as the oral contraceptive, in that it's basically kind of like a Band-Aid. Most women wear it on their torso somewhere, so it's near their uterus and can send the hormones through their skin to their uterus and signal to the uterus. This is a little more preferred by some women because you don't have to remember taking a pill every day. All you have to do is remember to put the patch on one day, and then once a week, maybe every Sunday or so, you remove the patch, put on a new one, and after 3 weeks of having the patch on, you then leave it off for a week. You have your period that week, and then after your period's over with, you put the patch back on and again go through that whole process all over again. It's got exactly the same failure rate and exactly the same side effects as the oral contraceptives. Then there's the vaginal ring, which is a ring that contains the estrogen and progestin hormones. And this is inserted into the vagina and sits just at the base of the cervix, exactly where the diaphragm would sit. But while the diaphragm is a physical barrier or block, this again works exactly the same way as the oral contraceptives. So same exact failure rate. Again, no protection against STIs. This one, instead of replacing it every week or anything, you just insert it one day. You leave it in there for 3 weeks. And then at the end of 3 weeks, you have to remember to remove it so you get your period. There is small issues with possibilities of vaginal discharge or irritation in the vagina. But other than that, it's very effective, and it releases the hormones locally, so you don't get it throughout your whole body, which some women prefer. Again, you need a prescription for this. And then there's a slightly more involved type of hormonal birth control, and that is the intrauterine device. This goes by the acronym IUD for intrauterine device. And as you can see here, it sits inside the uterus. Now, while it's fairly simple to insert things into the vagina, that's where tampons go, the Nuva ring or vaginal ring, and of course that's where the penis goes as well to deposit sperm. To insert something into the uterus, you actually need to dilate or open up the cervix, and that's really only done in a hospital. The cervix is there to protect the uterus from infection, and so dilating it is a bit of a challenge and quite uncomfortable. It's also what happens when you have your period, and that's what causes menstrual cramps, is the dilation or opening of the cervix to allow menstrual fluid to leave the uterus. So to insert this device into the uterus, you need to open up the cervix, which is uncomfortable, and implant this little device into the uterus. Now, there are two different types of IUDs. There's the copper one that you see here, and that does not contain hormones. And then there's the plastic one that does contain hormones, and a popular name brand for that one is Mirena. Now, both types interfere with sperm movement. The copper does that a lot more effectively than the hormonal Mirena one does. Mirena, of course, also contains progestin. And progestin, high levels of progestin, again, are going to prevent ovulation. Now, Mirena doesn't really contain estrogen. It just contains progestin that it slowly releases into your uterus. Now, what's nice about this one is that it releases it into your uterus. So again, it's localized. You don't have system-wide drugs going throughout your body. The other nice thing that a lot of women really like about Mirena, making it the second most popular birth control method among women after the oral contraceptive, is that Mirena, after about 6 months or so in your uterus, can cause entire absence of your period for 5 years. So usually the Mirena IUD is left in place for about 5 years, and in that entire time you don't have your period, which a lot of women find very freeing. The other really nice thing about these IUDs is that the failure rate is very low because the doctor implants it into the uterus, and then you don't have to think about taking pills or putting patches on or anything like that. It just sits in there and it remains effective. So for that reason, its theoretical effectiveness is exactly the same as its actual effectiveness, and that is less than 1%, making these the most effective, real effective birth control methods on the market. Again, though, these don't protect against STIs, so only to be used in monogamous relationships or with partners where you know their STI status. Some side effects of these. So the Paragard is different. The Paragard does not release any hormones, so it does not regulate ovulation at all. Instead, the way that it works is, as I mentioned, it does interfere with sperm movement, and the way that it does that is it actually causes mucus buildup in your uterus to basically create a very sticky mucus in your uterus, not in the vagina, but in your uterus, that blocks sperm from moving into the fallopian tubes. Some women like this option because it's one of the only options available to women that's very effective and does not contain hormones. However, one of the side effects of the Paragard IUD that's made of copper is that it can result in very painful PMS cramps every month, and you have a much thicker and heavier menstrual cycle every month. So unlike Mirena, where your period disappears after roughly 6 months, with the Paragard, the copper one, you get a much heavier cycle every month. There's also some discharge that can occur with some of these. And then there's very, very, very rarely, but in some cases, they have seen this, if doctors aren't experienced at placing IUDs, you can have pelvic inflammation result and even a tearing of the uterus, which can be very dangerous and reduce risk of fertility. So that is something to be aware of if you're considering this as an option. And again, because you're getting this implanted by a doctor, you would need a prescription for this. A doctor needs to insert it. You cannot do this yourself. From there, we're going to move on to a couple of other options, and then we'll be done with our birth control lecture.